Can anyone raise their hands who's ever had anesthesia before? Good. Has anyone been scared of having anesthesia? Have you had any family members who've had anesthesia? Do you know of anyone who's passed away from anesthesia? Or from surgery and you're concerned that was due to anesthesia? Well, I check all of those boxes because I've been a patient myself and been scared of anesthesia, and I know of people who have had anesthesia, and I've had a member who passed away from anesthesia when I was 16, my mother. So you can imagine growing up with that anxiety, thinking that anesthesia is a bad thing, dreadful thing. So this topic is of a great significance to me. So I'm here to debunk the mystery of anesthesia, okay? Anesthesia does not necessarily have to be scary. We do this every day. Anesthesia doesn't have to be scary when you empower your patients with knowledge. You entrust them, you connect with them. So in general, the anxiety and fears from anesthesia comes from not knowing what's going on, especially when you're anesthetized, you're very vulnerable. The fear of feeling sick after you've been anesthetized, and certainly the fear of loss of life or loss of limb. So those are very understandable concerns that could trigger anxiety with anesthesia. Surgery causes a lot of anxiety. Certainly anesthesia makes it worse. Next slide, please. So with all this in mind, I felt like let's create a project where we could really improve our communications with our patients. With us, the anesthesiologists, we do meet our patients on the day of surgery. So that doesn't give us enough time to create that bond, that relationship that our surgical colleagues, our primary care colleagues have the privilege of having. So you can imagine our time is limited. We have so many things to do. We're doing blocks, we're managing the ORs, we're running around and trying to reassure the patient that, hey, even though you don't see me all the time, but I'm here for you, I'm with you throughout the surgery, I'm right by your side. But the patient, sometimes they don't know that we're there because they're sleeping. So we have to find ways to communicate this properly with our patients, connect with them, educate them, and hence empower them. So when they come in on the day of surgery, they feel more comfortable, more reassured, more trusting, and hence can give a proper informed consent with us. Okay, next slide, please. So certainly, being a patient is a very vulnerable position that anyone could find themselves in for the prior reasons that I gave. There's a patient that I recently consulted on the labor floor. She's a 38-year-old female at 40 weeks of a gestational age with a second child who is a daughter. She had her son 13 years prior. And you can imagine with that gap of time, she is excited to meet this girl. But everything went on fine during the pregnancy until the third trimester when she was having severe migraine headaches, which she's had in the past, but now with aura, her left side feeling weak and just taking longer to resolve. So she ended up having an MRI. And that MRI was otherwise unremarkable. However, they did find just a slight abnormality that was concerning for a syrinx. Now, what do we do with this information? The OBGYN didn't think it would impair her to have a natural delivery, a vaginal delivery, but thought that, having a regional anesthesia like an epidural for labor pain or spinal block for cesarean delivery could be of concern, even though maybe on the low side, but always a concern. And she told her that it would be determined on the day of surgery. And then this was a month before the patient presented for an elective induction. So you can imagine sitting at home a month and worrying. Then I'm gonna be hurting, I don't wanna be asleep and not see my daughter. So I came in, reviewed her history with her and her imaging and determined that it would not be a contraindication to have a regional anesthesia. And that was of great relief to her. And they did go ahead with the induction for labor. So a lot of patients we meet every day, and I kind of group them into 4 categories. The first category subgroup is the patient who doesn't want to know anything about anesthesia because it just would scare them to death. Go ahead and do what you have to do. And on the extreme, you have the patient wants to know everything, including the drugs, the procedures, and beyond their scope of what they need. And certainly that creates an anxiety too. And then in the middle, you have patients who want to be informed, they want to know. And sometimes they get the knowledge from the internet, Dr. Google, from neighbors, from friends, from who have had prior experiences. And sometimes the information is not as accurate. And then you have the patients who want to speak with their specialist, the person who will be giving them anesthesia, like in this case, the labor patient, and they don't have the opportunity to meet us ahead of time. So this both brought this idea that, hey, listen, let's jump into this and be in control of this information and communication, create channels to communicate with our patients so they could have the proper information and feel comfortable. And this is where we came up with the vision. Next slide, please. The vision for this project, to create ways to meet our patients before they see us. So I came up with a plan, created a team, which included my anesthesia colleagues, the administrators, the pre-surgical nurses, who usually are one of the first people who interact with patients before they come in for day of surgery. So they ended up having lots of questions that they don't have enough information to answer this for the patient. So, and then obviously the patient, who is the center of everything. Next slide, please. So here goes our team. Next slide, please. And so through all of our collaborations, we said, listen, what can we do? How can we improve communications? We, see our patients on the day of surgery. We consult with them in-patient consults when they come in before surgery. We meet with them in person. We do telehealth through the phone or through videos. So you know what? That may not be enough. There could be more we could be doing for our patients. So we said, you know what? Why don't we talk about anesthesia, the different kinds of anesthesia? It's not necessarily about the science of anesthesia, but just the different types to explain to patients, to relieve their anxieties, to know what is applicable to their own cases, and also certainly what to expect and what side effects to anticipate and how we manage that. And so, we could put that in pamphlets and give it to these patients when they come into the pre-surgical clinics or outpatient and surgical centers. We went ahead a step further and said, you know what? We could also create videos that explains all of these things, including the regional part, the regional anesthesia, patient having labor, epidural, spinal blocks, and nerve blocks, and just all the great things that we do, so the patient could visualize that, hey, listen, maybe it's not really as bad as we think. This is good. This is good. This is for our benefit. And we have this video bank that we created that they could access through computers, the iPads that we have in the pre-surgical clinic. And then we said, you know what? Not every patient comes to the pre-surgical clinic. Not everyone is able to meet us before surgery. But every patient can virtually access all of this information through their charts, called the My Chart. So why don't we put all of this into this portal and give them instructions on how to access them? And that's what we did. So every patient could literally sit at their home, click what kind of anesthesia, side effects, what is a video, regional anesthesia, and before they come to us, they feel informed, empowered, and feel more relaxed. Next slide, please. So what did we learn? We learned that this goal was very achievable. We had teams that were excited to be a part of this because they're very invested in patient care and making sure the patient is satisfied and informed and empowered. We realized that the patients, most of them were pretty much satisfied and not as anxious as we feared, but however, there are few that felt like what we're doing mattered to them, made a difference. They were very grateful that we took the time to go a step further in listening to their concerns and addressing their needs, and hence being a part of the team, patient-centered care. And we also learned that that it's okay to create multiple avenues of communication is not just sticking to one thing, but meet the patients where they are. Even if they can't come to us, meet them at their homes through their charts, videos, and all of that. It certainly makes a difference. Certainly, we wish we had a variety of patients, including the pediatric patients, who usually do not present before through the surgical clinic. So to meet their parents, to include them in all of these several questions and answers that we receive. Next slide, please. So in conclusion, we say stay inspired and never stop trying. Never stop trying to communicate with the patients and make them feel heard, comfortable, important, and empowered, because it does help with patient satisfaction and certainly helps with patient compliance, because a patient that feels well taken care of certainly wants to do what you expect them to do in taking care of themselves. So while we take pride in providing great anesthesia for our patients and our family members and our neighbors, we also realize that our care not only happens when we meet them, but rather before our patients present to us. So we want to take time to reach out to our patients, make them feel heard, and make them feel safe. Thank you very much.